All right, folks, we will convene the October 3rd meeting of the Board of Health. I'm John Strand, your chair, and we'll just run around the dais and introduce ourselves, and starting over here. Oh, you're, okay, we'll do roll call, then introductions. Thanks, Lori.
Yep. Dr. Andrew McLean,
Here.
Jamie Steig, Grant Severson,
Here.
Avish Nagpal, John Strand,
Here.
Bernie Dardis,
Here.
Jim Capitan, Meg Forty,
Here.
Valentina Asid. I believe she's virtual. Valentina?
Yes, can you hear me okay?
Yes, thank you.
Yes.
Great, thank you very, very much. We'll still introduce ourselves. Go right ahead if you would. Whatever you want. It's your moment.
It's my moment. Hi, everyone. My name is Meg Forty. I am a registered dietitian. I received my degree at NDSU, so I see some, are these NDSU fans over here? And I am excited to be here today with all of you.
Good afternoon. I'm Bernie Dardis. I'm the mayor of West Fargo.
We'll go to my right.
I'm Grant Severson. I'm a pediatric rheumatologist. I went to UND, but I'm not opposed to NDSU. So.
Hi, Andy McLean. I'm Chair of the Department of Psychiatry Behavioral Science with the Medical School and Associate Dean for Wellness. Thanks.
Great, thank you very much. All right, our first item on the agenda is to approve the agenda. Could I have a motion from the dais to approve the agenda, please?
So move.
Moved by Bernie, is there a second?
Second?
Second, all those in favor say aye.
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 Any opposed? Okay. Next would be to call for approval of the minutes of our July 11th meeting. If I could call for a motion for that, please.
I just had a correction on the minutes.
Certainly.
So in Great Britain, surgeons are called Mr. In mine, we probably want to use the title doctor.
Okay, so that was incorrect in there,
Yeah.
it was Mr.?
Yeah, right.
Okay, we'll get that corrected for any of our MDs. Any other corrections or additions? Thank you, Dr. McLean. Could I have a motion to approve the minutes, please, as amended?
I motion.
Motion, is there a second?
Second.
Second, all those in favor say aye.
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 Any opposed? Nay? All right, we'll continue. Updates, I'll call on Jen Fall from FargoCast Public Health, and we'll get any updates from her.
Actually, didn't have any updates. We're going to do those in the current public health matters. My apologies for not catching that earlier.
Okay. Now we will go on to item number 5, which is the tobacco program. And Jen, why don't you introduce us and tell us who will be talking to us about it, please?
Speaking today will be Abby Lang. She's been with the Tobacco Prevention Program and the Health Promotions Department, and just going to be reviewing. I don't know if this is part of your slide already. I don't want to take away your thunder, but be reviewing with you the work that the Tobacco Prevention Program is doing.
Thank you, Abby. The microphone's yours.
Perfect, thank you. Yes, I'm Abby Lang with FargoCast Public Health. I'm just here today, again, to just reiterate what we're up to kind of with our tobacco program and what kind of our roles are. But first, really, to get into what our program is doing right now, I think it's important to kind of take a step back a little bit and talk about where we came from. And the programming for FargoCast Public Health came from the Master Settlement Agreement in 1998. And what that was that 46 states, really all 50, sued the top 4 tobacco manufacturers. 4 of them, settled outside of this settlement, but the 46 states settled. And what that means then is they collect money every year that these manufacturers sell cigarettes in each state. So the amount of money that North Dakota gets is based on the sales of cigarettes in North Dakota. Each state gets to do something a little bit differently with their program. However, North Dakota has their own state program of the Tobacco Prevention and Control Program. So each year, each of the public health units write a grant, and we are awarded grant money based on our population and some of the work that we're doing that comes then from the state. So what do we do? Sometimes it feels like a lot, but we're always busy with Happy Busy. We have kind of three things that we really focus on. The first is prevention, of course. Our main focus is deterring youth from ever starting with any of these products. I do want to highlight under that, we do have the Youth Action Summit we have every year that we host in Fargo. It's the eastern side of the state, really a regional summit that we get a lot of youth together in middle school and high school and talk about what tobacco products and nicotine products mean to them and ways that they can kind of start some of their peer leadership of bringing it back to their schools. So we're really excited. That's coming up next week. First Cessation, that is really obviously a lot of times adult focused. We are starting to get more into the youth focus with that as well. We are seeing a lot of youth using tobacco products. So working on that, removing barriers for treatment for them of all age groups, really. And for policy and outreach, we really try to focus a lot on getting out in the community as much as we can, whether it be something just as simple as today and giving you this presentation about what we do, but also going to businesses or to PTAs, anything that we can do just to get the word out of kind of the work that we're doing. So we always welcome any kind of invitation that people have for us to come and speak about what we do. The other piece kind of that too is there is still secondhand smoke exposure. So we do help deal with some of our smoke-free law complaints from our smoke-free law still that was passed in 2012. And really kind of what is the guts of really what we do is focusing on talking about how nicotine changes the brain, especially of our youth that are using it. And it really causes changes in two ways. There's physical changes and there's chemical changes. For physical changes, it's really our brains are still developing until you're 25-ish. And so that last piece that's developing is the frontal lobe or your prefrontal cortex. It's right here in your forehead. And the piece that nicotine does is it starts to make that more hypodense, meaning it kind of makes it like kind of smaller. It's a very basic way of putting it. And that is kind of permanent. As your brain develops, once it kind of is there, that's how your brain is. And so those changes are pretty permanent. The chemical changes that it does is that you can see from my picture that I have up there, nicotine works on a bunch of neurotransmitters or chemicals that are in your brain. And our brains kind of have these chemicals are ebbing and flowing throughout the day. Think about, I'm not a morning person, so when I wake up, I'm a little grumpy, but I don't stay grumpy the whole day. Our moods kind of shift throughout the day. And so you can see from this photo that nicotine works on these, and a lot of these things are what people would consider to be very positive, having the reduction of anxiety and tension, appetite suppression, cognitive enhancement, memory enhancement. And so a lot of youth even say to us, well, like, that sounds really great. And it's kind of one of those things where if it sounds too good to be true, it's because it is. And while it happens very quickly, as those chemicals are changing in our brain throughout the day, when you have this huge influx of these chemicals and then a huge decrease of them once the nicotine is out of your system, that's what starts having some poor emotional regulation issues. These, luckily, are the thing that can be reversed back to normal. The second you stop using nicotine, these start to go back to their normal levels of what you would have without the nicotine. However, that's always the biggest issue people have with quitting is because they get to be grumpy and start having some of that increase of the anxiety and tension. So what are we seeing with our current kind of landscape in North Dakota? These graphs are from the North Dakota Tobacco Control Program synthesis report. So every couple years they put out a pretty in-depth report of what we're seeing throughout the state. And so they gave me permission to share these. It's a public document that's like 40 pages long if you ever are looking for some light reading. But the current use of cigarettes that you can see in adults in all of the priority populations that North Dakota has ever focused on is going down. However, you can see in the red there that e-cigarette use is going up. And I would like to point out with the graph on the right, what makes this really maybe perhaps more worrisome is there is something called the adverse childhood experiences. And as we're seeing people using nicotine to cope, we're starting to see it cause kind of a snowball effect where it's working on more things. So the more that people are having these adverse childhood experiences, more that they have, the much more that they're likely to be using tobacco versus alcohol or cannabis for that coping. And as again, we think about my previous slide, that coping is helpful for a very short time, and then it kind of causes more harm than good otherwise. And the data for this I should also share too is from the BRFSS, which is the Behavioral Risk Factor Surveillance Survey, is where they're getting the data from. So this is North Dakota data here. So for our youth, this is a little bit busier graph, and this is coming, again, it's from the North Dakota Synthesis Report. This data is being pulled from the Youth Behavioral Risk Factor Surveillance Survey. So this is focused on just youth in North Dakota. And as you can see, the good news is that the use of cigarettes and e-cigarettes are going down. But if we again look on the right, we're seeing that the more that our youth are having poor mental health days in a row, the more that they're using nicotine again versus alcohol or cannabis. And again, our youth that we're working with are telling us the main reason that they're using this stuff or kind of starting to stay using it with mental health days is for that reduction in anxiety and tension and that mental health aspect. So what are the youth using? Really electronic cigarettes, vapes, e-cigarettes are the most popular product and have been since they landed on the market in 2014. They were able to create something called a nicotine salt, and that is where they can pack a lot more nicotine into each device to make it so you can have a significantly high nicotine content in this small device. So a lot of those devices in that picture are equivalent to hundreds of cigarettes, if not thousands in some cases. For all the things that are in an electronic cigarette, the ingredient list is very short. It's 4 main things: propylene glycol, vegetable glycerin, nicotine, and then a food grade flavor. And really propylene glycol and vegetable glycerin you can find in some of our food products, processed food products. All of those things are absolutely safe to be in our stomachs. But just like with cigarettes, e-cigarettes have combustion happening, and that combustion, when we are heating these things up, it's changing that chemical reaction, now causing them to have, where we're starting with these 4 things, after we add the heating element, we're having a list of lots of things. All of those things are going directly into our lungs, and that's specifically where we're seeing that EVALI or the popcorn lung. Luckily, that kind of peaked in 2019 and the EVALI has consistently gone down. But we're still seeing these products be everywhere. The other piece that I wanted to mention about electronic cigarettes is that they don't have tar in them. And so oftentimes people that will smoke cigarettes will have that kind of smoker's cough that we're all very familiar with and that congestion that's there. You don't have as much congestion that you feel by not having the tar in the e-cigarette, making them feel like their lungs are better, which is a common piece that people add when they would like to switch maybe to a e-cigarette from a regular cigarette. Nicotine pouches, this graph is a little bit different. Nicotine pouches are really the newest thing, and they're like a snooze type product, again with nicotine salt, so they can have this high concentration of nicotine in them, and they too have the high concentration of numerous cigarettes. This graph that's on here is throughout the United States, and it's kind of what I put it on here for was to show you just in 5 years the growth of the sales of them. There's not a lot of data. Our YRBS does not have any data on nicotine pouches yet. This year, the one that's coming out in the next month or so, will have the first data where we'll have usage rates in North Dakota than has ever been before. So just in 5 years, you can see the sales of these things kind of exploding and becoming very popular. And a concern that we have, especially for youth, is that you don't have to swallow, like kind of the old school chewing tobacco we're all probably more familiar with. You don't need to swallow, and these are things that can be very discreetly packed in their gums, where we see youth very commonly having 2, 3, 4 of them in their mouth at one time, which would be, again, smoking numerous cigarettes at one time. So kind of what attracts youth in the first place to any of these things? We see a lot of social media influence, and it's not even necessarily influencers on TikTok using any of these or saying that they should use them, but it can be someone in the background using them, or the TikToker, making a dance but using one of these products too. Social media has become explodingly a big influence for our youth, that they're really kind of wanting to be like them, and so there's a lot less regulation of where these products can be seen. And again, kind of going back to our brain development discussion is because of their brains developing, it's so much easier for their brain to be primed for addiction much quicker. So when I talk with our youth, I say, if you and I started using at the same time and we use the same amount, it's very unlikely for me to have as much damage to me than to you because of your brain still developing. And that's what's the piece that we really try to get through with them. And a lot of people say, well, this is tobacco-free products, the nicotine pouches and the electronic cigarettes. However, nicotine is the piece of the tobacco leaf that's extracted. So while there's no tobacco leaf necessarily needed, we're still getting either synthetic nicotine or nicotine extracted from the tobacco leaf. It doesn't make it any safer being tobacco-free. Lastly, our brains are really primed to like certain things. Personally, I'm one of those people that after I'm done cleaning my house, I light a candle, and it's like that's the cue that mom just cleaned the house, and so please don't make a mess. But just with those things is our brains like certain scents. All of us like different things, and there's a lot of flavors that are being added. There's over 15,000 flavors on the market for different things, and these flavors have certain scents as well as having that certain taste. So there is a flavor out there that all of us will be able to find one that we like or that we like the smell of. And it doesn't even have to be that you use that same flavor over and over again. It just has to be enough for them to be willing to try it a few times to really start getting into that. And so that's kind of a huge piece of that scent and that aroma where, you know, most of the kids can say that they think cigarette smoke smells bad and they're not as interested in it. I just threw a whole bunch of information to you at one time. I apologize for that, but this is kind of some of the things that we're seeing, we've learned, and what we're working on and what we're doing. So I would be so happy to take any questions, clarify anything for any of you if I can. And here are I have my references as well.
And thank you, Abby. Before we, just for a moment, two members have joined us. If you could introduce yourself, please.
Jim Capitan, Cass County Commission. And I'm sorry, Mr. Chairman, a train delayed.
That's okay.
Same. Jamie Stagg, pharmacist and board member.
Thank you. Now, I'll open the floor for questions or feedback. Dr. McLean?
I have a question. Comment first. I actually took the underpass anticipating that train would come. So,
He's the smart one up here. I'm not sorry. Sorry, that's an awful thing to say.
So thanks for your presentation. Two questions. One, is the decrease in the valley, the lipoid pneumonia sort of problem, due to a better tightening of counterfeit cartridges? Or?
Unfortunately not. What they have seen in some of the counterfeit cartridges is those are exploding everywhere. The main thing is with some of the EVALI, I could go down a rabbit hole with you for a while, but we actually found out about EVALI from a microwavable popcorn factory in the early 2000s. And so they used some of that knowledge that they had from that and transmitted that into some of the manufacturers have changed a little bit of their ingredients and how they put the kind of the propylene glycol and the vegetable glycerin, the percentages. We haven't seen, there hasn't been a around long enough yet to see how much and what. There's a lot of different theories over why that could be, if it was really what the manufacturers changed, if it's that people are more aware of it and so they're not, people are maybe being more cognizant of that kind of thing. That one's, I would love to give you a better answer than that.
Second question, maybe a softball question. What have other states found that have limited the use of flavored e-cigarettes and youth addiction?
A lot of states are doing a variety of different things. There are a few states out there that have completely banned the sale of any flavored products of all throughout. We just got the first report from California out about the change, and that did decrease the flavor, the use overall. Still very in the early stages. Massachusetts is another one. New York is the third of kind of the bigger ones that have had these regulations that have assisted. But we're still gathering data on exactly where that is and what that will look like in the long term.
Anybody else? Jim?
On these pouches that I see people put in, is that all nicotine?
Yeah, so it's powdered nicotine that they make, like just little microns. It has nicotine, but there also has to be a filler in there too, because when the nicotine is going to be absorbed kind of into your bloodstream in the mucosa, it will sting, and so they have to have other fillers added into that. And that's where the science that we have is really lacking on exactly what's in there and what it does once it's absorbed into the body. So there's not a lot of other fillers in there, but it's still enough where we aren't sure. The studies that I know about are at Penn State that are in a couple years out yet of really being able to publish their data.
And is that on an increase? Because I noticed that one of my older nephews, I caught him putting that stuff in his mouth, and I said, what are you shoving in your mouth? You're not chewing, are you? No, it's a pouch. It's safe. Yeah, right.
Yeah, yes, yep, that's what we see a lot with again, that misinformation, and still it's kind of, again, there's other chemicals that we could get into, but the science of still the nicotine on the brains is, for the youth, is really, I mean, really until you're 25, it can really adjust kind of your entire future of what your brain looks like.
Well, he's a lot older than 25. I thought he had more brains than that.
Anybody else?
Yeah, I had a question. You talked about doing presentations at the area schools. Are you working with the schools in other ways?
We are, yes. So we actually go into all 4 high schools this year. Last year was our pilot, but for the youth that are getting caught, one of the main things the schools are hearing all the time is the electronic cigarettes or the vape detectors going off often. So we are going in all 4 high schools and bringing our kind of cessation to them. So a youth is pulled out of class for a little while. We work with them, and we're trying to make that proactive as well, that it won't be that the youth has to wait to get cited to get our help, that they can come to us too. And so we're working with the schools on how we can continue to provide that. But the main thing that we do health class presentations, and then going into the schools, providing some technical support for what this kind of huge issue of the use in schools and the lack of some of the kids to be able to even concentrate during class because they're waiting for their next hit. We're working on the cessation piece, and we're going to hopefully continue to grow that. Thank you.
You reference 4 schools. What are the schools?
Oh, yep, so they're in the 4 Fargo public schools, the 4 high schools. So, but I do go to West Fargo for the presentations for the middle schools.
Thank you.
Yep.
Anybody else?
What are some examples of other community level actions that can be taken to help address this issue?
That's a great question. One of the things is I think it truly is that people don't know the harm that it is. I think the advertising has been done so strategically by the tobacco companies that people have no idea. I like to sometimes say, you know, my generation, we were so close in the late 90s, early 2000s to having tobacco sales at the lowest that they ever have been. And they just kind of switched their product around, switched their marketing, and it has just exploded. But, you know, I'm at least old enough to remember what it was like to walk into a restaurant to say, I would like to sit in the no smoking section. And I think some of that too is just people, we've lost touch with some of that, and we've lost a little bit of touch of recognizing still that the harm is still there.
And Valentina, online, if you have anything, certainly join up with us.
Yes, thank you so much, Chairman Sharon. So mine is more of a comment. So I know recently there was a bill that was passed for the increase of tobacco taxes, correct?
I'm sorry, could you ask that one more time?
Yeah, I was just asking if there was the bill that was passed to increase the taxes on tobacco, correct?
So we haven't raised our tobacco tax in the state of North Dakota since 1993. So there has not been one that has passed for that. The previous session, not 2025, but 2023, there was a session that finally at least put our e-cigarettes into the regulatory standards throughout the state of North Dakota, but we have not, right now there is no tax on any e-cigarettes or pouches either for the excise tax for that at the state level.
Because I was wondering how that could impact the usage or purchase of these products by the youth.
Yeah, so the CDC puts out what's called kind of like the three-legged stool of the 3 pieces that we know are the most successful in curbing youth use, and increasing that excise tax on the tobacco products is one of the main ones. That has always been kind of a thorn in everyone's side at the state of North Dakota that we have not gotten that any further, but that is one of them too. The more that we make it expensive, the youth won't, they'll spend their money on their Nikes and their Squishmallows and whatever else. So that's one
thank
piece
you
of
so
the,
much.
yeah, thank you.
Okay.
Anybody else? Thank you, Abby. My guess is that this board will be having more discussions about the tobacco-related policies and nicotine, and this is where we'll be vetting if there are any policy recommendations and changes. It'll probably start at this table.
Perfect. Thank you so much.
Thank you very, very much. I'll call on Jen to introduce our next topic, which is a community health assessment and community health improvement plan.
I need to first say that I stand corrected. We do have an update to review from our last meeting in July, and it is to change the language to the bylaws. And so there was a conversation in July where the previous language for public notice was that public notice will be given in advance of meeting in the Fargo Forum. And we changed that in our meeting on the 11th to read, public notice will be given via notification to the city's media contact list, as well as postings on city website, FargoCast Public Health Facebook, and X social media accounts in compliance with all open meeting requirements in accordance with state statute, North Dakota Century Code, Chapter 44, Section 04. The Fargo City Attorney Nancy Morris suggested shortening that to read, public notice will be given in compliance with North Dakota Century Code, Chapter 44, Section 04, line 20. That would still cover all of the things that were in that longer section that I just read above, and just wanted to bring that back to you as an update in language.
So Jen, I would consider that a housekeeping item, as far as an update on a policy or a policy, basically? No change or action required?
Do you vote to change that language in the bylaws?
So you'd like that put on the agenda today?
Yeah, I'm just taking that back up to the updates for that to be, that was a carryover from our last meeting.
I gotcha.
Apologies.
So there was an update that we need to act upon?
Correct.
Is this making sense to everybody? Okay. Nancy, any clarification or anything from the legal perspective? Nancy Morris?
No, you do not need to identify how the city of Fargo makes that notice. It just has to be in compliance with state law, and we do that.
Okay. That being the case, I'll call for a motion to comply with this going forward.
So moved.
So moved by Jim. Is there a second?
Second.
Any discussion or further clarification? If not, I'll call for a motion, or vote. All those in favor say aye.
Aye.
Any opposed? Okay, any opposed, nay? Thank you, Jen. That's now addressed. Now you can go to the community health assessment.
Thank you.
update.
In our last meeting, we had Maggie Riddle also present to you our community health assessment. At that time, it was high-level data and discussion that we had filtered through, bringing us to priority areas. And so just moving through our steps in the process, that was the community health assessment, and we did our internal and external stakeholders meeting to resolve the community health assessment on May 16th. That brought us to our community health improvement plan conversation, which was hosted on August 27th. And we are still working through a draft form of that as to the goals and objectives we have identified. And we have also identified the outcomes for some of those goals and objectives, but we'll still be working towards the people who will be delivering some of those services. I'll be reviewing that with you momentarily. We'll be moving forward into our strategic plan, and some of you have an invitation to attend that as an external stakeholder with us on Tuesday morning next week, and that will be facilitated by Achieve It. We'll be moving into quality improvement planning after we post our strategic plan for any kinds of house issues that we need to move to improve our standings or our outcomes at that time. That is not in development at this point. So back to our community health assessment, again, Maggie Riddell was here and presented on that. She has been, since that time, writing all of the sections out to accompany the data and to give the narrative version of the community health assessment, and that is coming in, and our directors are reviewing and correcting drafts of that right now. When it is completed, and we've all given back our feedback, we would like for you as a board to also have an opportunity to review the community health assessment before it's published, and to be able to ask any questions or to work through any data issues that you are seeing. I know Meg had some questions when we had presented it last time, and really to give the board an opportunity to move through that with us before we publish it online. Our community health improvement plan will be part of that as well. And so the priority areas that we identified in the community health assessment were access to healthy foods and health and wellness. When we moved into our community health improvement plan, we identified that first priority area and then created a goal to increase the distribution and access of healthy food within Cass County. And it became part of the conversation that we were having with the people in the room, the people who are working with food through the community, and understanding that there is a lot of food in our community, but distribution has really been quite the issue to getting it to the people who need it. And so identifying that as one of the things that was new to a lot of us in the room. So we want to establish, as our activities and tactics to accomplish this, is to establish Fargo Cass as a satellite food pantry, both during and after business hours, to help support the population that comes through our doors. And even when we do in-home services to our MCH clients, and we're traveling out into the community and out into the county to deliver that care. To expand the capacity of food storage for those in need at the engagement center. One of the conversations we've had there is that if there's somebody who does have food, they would either have to consume it all day because they don't have a way in which to carry it, keep it, and preserve it. But we'd like to add more opportunity because they do get food available to them at the engagement center, and we just need to expand the capacity to which we can keep that there. Assess current capacity of the Kitchen Coalition to meet demand for the availability of food repackaging and the potential collaboration that we could have at Fargo Cass Public Health within our kitchen area. And so this is a group that works in the Fargo-Moorhead community to take food that hasn't been served, could be repackaged, and is utilized then in either family repackaged meals or individual meals, and is then given out into the shelters or other areas of need. We would like to host City of Fargo food drives as a large group of employees to have food drives to support our initiative, to assess the Cass County schools for food insecurity, screening, and their need and capacity to provide food for students to take home. And there are multiple schools throughout the county actually that do backpack programs. There's pantries in some of the schools that people can anonymously go to and take what they need, but also to look at what they're doing for screening for that, but in some of the repackaging that the schools are doing. Part of the great part for us is that we have our environmental health group that goes into all of the restaurants and food places within the Fargo-Moorhead community, within the Fargo community and large parts of Cass County. And so we want to be able to talk with those folks as well. And if that's one of the ways we get engaged into the Kitchen Coalition or the repackaging of food, that would be, and they're also in our schools. We started those conversations as to who's doing that repackaging and saving of food that had been done during COVID, prior to COVID, and had since stopped. So we want to revisit that again. We want to aid in the transportation of food to community members, and then have Fargo Cass Public Health employees to actively participate in the planning and zoning in the next growth plan, to advocate for the healthy food locations and groceries and gardens within the community. For our goal 2, under the same priority area, we've looked at the increase of awareness of healthy food resources throughout the community, and for all of our divisions within Fargo Cass to participate in screening for food insecurity. When we look at this, we know our WIC program is doing this, our maternal child health group is doing this through nursing, and our clinic is doing this. And so there's different ways in which that data is collected, so we want to make sure we're asking the question as frequently as we need to be, not missing that opportunity so that we can connect people to resources as they are needed. That all divisions will provide food resources to clients, and and entities engaged within Fargo-Cass Public Health to include childcare settings, the clinic, our Y and Right program, and in-home services, WIC, victim impact panels, et cetera. So anybody who is partnered with us coming into our programs would have opportunities to have access to that. To host healthy food education opportunities through gardening, food preservation, again, using the teaching kitchen availability, and then dietary impacts on disease prevention. And then to host a hunger simulation. And I'm not quite sure what all of that is, but there's groups that have been in our meeting that would love to hold that at Fargo-Cass. For priority area number 2 was health and wellness, and this covered a significant array of services that we could put under health and wellness. The goal that we identified first was to improve the prevention and early detection of disease. Our actions and tactics are to increase policies and outreach activities specific to decreasing youth tobacco use rates, much in line with today's presentation, as we'll continue to be the advocates for that. To increase responsible drinking through education and awareness, to expand outreach and education on STI and STD, to increase awareness and outreach for cancer screening available at Fargo-Cass. That'll include breast cancer, skin cancer, and colorectal cancers. And then Fargo-Cass Health to employ an enrollment specialist, and this will help us to get people to continue to expand access that they can have through us, but then also through other entities. An enrollment specialist is somebody to help with insurance. With some of the changes that we see coming within the 2026 medical assistance re-enrollment requirements and frequency, there's not going to be enough navigators currently, so we will be looking to hire our own. Goal number 2 under the same priority area is to focus on improving the health outcomes for Cass youth by actively promoting healthy lifestyle choices. And that's we're going to be looking at increasing the time of physical activity requirements, making that evidence-based and looking at good protocols. We currently have an ordinance that we are looking at that we are obligated through our health promotions and protection department to go into, and they look at child care centers. They do checks on them throughout the Fargo area, and they look to this ordinance actually to make sure that they had been previously getting, I think, 1 hour of physical activity. And we want to look at what is the current amount that would be recommended to make sure that children are up and moving around and being active. And so we would look to have that, and then to increase that for other daycares and after-school programs and summer child care programs. To provide education on the benefits of healthy food and disease prevention, and having dietitian-developed menus, healthy snack items for some of those daycare spaces as well. And then to pursue the initiation of physical activity standards for daycares through Cass County. Currently, Cass County follows the state of North Dakota as their ordinance, and the state of North Dakota does not have a physical activity guideline. Any questions on that so far?
Anybody had feedback or follow-up?
Could you go back to the slide number 1, your first slide, Jen? No, you're too far back. On the strategic plan, you make this is the one, thank you. You make a comment on bullet point number 2 with regard to the engagement center, a capacity of food storage. Could you share with us the scope of food that is provided at the engagement center?
Sure. Currently, we receive packaged meals from the New Life Center, and those are distributed out then daily. If they are not all used, we have a small amount of space that we can refrigerate and freeze them, but not a lot of space. And that is the meal, that might be the only meal that those people receive.
But it's packaged food coming from the New Life Center?
Correct.
Okay, thank you.
Let me verify with Jan, who knows 100% if we're receiving any other food.
New Life Center and the Kitchen Coalition, which work together along with the Great Plains Food Bank. Fantastic program. They provide about 600 meals a week.
Thank you.
Anything else? Jen, I maybe have really the dumbest question in the world, but and maybe this is a topic going forward, but as I understand it, the highest risk young people face these days is gun violence. Are we at any point, are there any jurisdictions or public health units that delve into that topic for us, at the local levels, that might be an area we keep an eye on and keep our finger on the pulse of the community and see what issues or policies might need to be discussed or explored?
I believe historically, and I believe we still do, and I'll verify that with Suzanne, but we've done like the trigger locks for guns as in something that the MCH program has done, and I believe still, I know they have done, Suzanne.
Yes, so within all of our nursing programs, our adult health in-home visits as well as our maternal child health visits, at ADMIT, we bring out information regarding gun safety. We aren't, promoting, we aren't taking a political side of it. We're just talking about if you're going to have a gun, let's have it be safe. And so we've worked with the VA, and the VA has provided us gun locks that we can provide if families want them to keep their guns safely stored.
Okay. Anybody else? Thank you, Jen. We'll go on to the next topic, and that's strategic planning. I'm not sure if you've covered some of it already, but it's on the microphone's yours.
Certainly. Just that strategic planning will be held next week on the 6th and the 7th. 4 of you have been invited to that who have identified wanting to be present and participate in our planning series. Commissioner Strand, Jamie, Dr. Severson, and Valentina are invited to participate with us on the morning of October 7th. Achieve It is a digital platform in addition to the facilitation of the strategic plan. They work with the CDC, they work with the U.S. Department of Veterans Affairs and multiple colleges and other public health areas throughout the country. And the platform will allow us to have an API written so that it will take data from the other softwares within the divisions of service that we provide at Fargo Cass Public Health. And it will allow us, when we have our community health improvement plan and our strategic plan identified and what those deliverables will be to the community, it will allow it to have data that will be transparent on a dashboard for the community members to be able to see that. So they will know where we're at with our activities and where we are on date of achieving those activities. It will allow the directors and myself as well to, there's divisions down, so if you have the goal, the objective, and the tasks, it will monitor for activity, and if we're not meeting the mark, it actually starts to change colors, so you can do a quick dashboard look to see like where is there not progress being made, so we can identify more quickly on where we need to focus our efforts.
Mayor Dardis was asking, does it start at 8:30 Tuesday, and is it at Fargo Cass Public Health?
It is at Fargo Cass Public Health in the Oak Room, and 8:30, yes.
8:30, okay. Anybody else? All right, go ahead.
I just wanted to give Holly my RSVP. I hadn't sent that yet, so.
All right, and Valentina, anything from you online?
Was that
No,
enough?
I do not have any comments.
Great, thank you. And don't hesitate getting my attention if you need to chime in, all right? Item number 8, lab, great. Lab director update. I'll start with Jen first.
Yeah. So there is a next slide for this as well. We would like to thank and congratulate Dr. Lindeman for becoming our lab director for Fargo Cass Public Health. To do this, she took 20 hours of credentialing units of education for us to be able to have all of the moderate complexity labs back in-house at Fargo Cass Public Health. This had changed last July when our lab director had left, and she had the credential to be able to run a moderate complexity lab. Without that credential and without being able to recruit somebody who had that, we have a wonderful lab technologist and technician right now, but they didn't have the hours or the supervision necessary to be a lab director. Dr. Lindeman was willing to do this, and we are now able to do more of our labs in-house. It will expedite return to our clients and our ability to treat them, and it will also decrease the amount of labs we need to send out to another lab company, which has been incredibly costly for us to do, and then insurance companies do not want to reimburse a third-party lab. So it is, it's going to save us a tremendous amount of money and increase our patient care and timeliness. So very much grateful for the opportunity for her to do that for us.
Dr. Lindeman, would you like to add anything to that?
No, I appreciate the opportunity to be able to take this course. I did learn some interesting things. It was actually a pretty interesting course. I look forward to looking with the other members of the lab, and I'm excited that we're going to improve patient care for our patients by having a better turnaround time on our labs.
Great. Anybody else? All right, Jen, we'll go on to the next item, which is a commission update, please.
So we had our commission meeting on Monday evening, and this was one of the one of the slides that was up there. One of the topics for the commission meeting has been the engagement center, and this map here identifies the 3 areas that we're looking at, the 3 properties that we're looking at. We did host a town hall. Mayor Dardis and I spoke about this just briefly before the meeting. But just looking at the 3 sites, the pros and cons of the sites, the costs of the sites, and the retrofit of each one of those is now what's currently under development, and so we can come back with a better understanding of what we can propose to the commission. There was a town hall that was held with our panel of people that are at doing services at the engagement center currently, and it was well received in the good showing of community members who participated in that conversation. Thank you, Jamie, for coming to that as well. And we will just continue to work so we can get into a space and provide care that needs to be provided for this population. Just wanted to pass on where we're at with that. And then also from the commission meeting update, we passed our budget on Monday night as well. And then Melissa will be talking about the budget momentarily.
Okay. Any questions or follow-up for Jen? Especially on the deck conversation at all? Jamie?
I just wanted to make a comment in that attending the community forum, I want to compliment and give my appreciation to the staff that was on the panel and to the community partners that were also on the panel. Something that came through to me is there's, and with the presentation that was made in that, is that there's not an easy button on this, and there's pros and cons to every site. And what I appreciate is that the staff is focused on finding solutions and navigating that course. And so I just wanted to compliment all of you on your efforts and on keeping the focus on trying to serve these members of our community that are served by the Engagement Center.
Anybody else? Mayor Dardis?
I would like to echo that. I participated virtually and observed it, and the passion on both sides of the issue is very strong. But I was struck by the professionalism of your staff, and I'd like to personally call out Jan, how you answered the questions very direct and succinctly, and it's a tough issue, but the professionalism came through, and as well as the passion of serving this aspect of the public.
Anybody else? All right, we'll continue on to the next topic. Current public health matters. That could probably take a few days. Is that you, Jen?
I will, and if there's anything Dr. Lindeman would like to jump in on, that would be great. I'm going to go through some of the things that have been shared with us from our state agency and communities, city and county health organizations, have shared with the public health administrators, as well as our hospital preparedness and emergency preparedness. So these are really slides from the North Dakota Department of Health and Human Services and some of the meetings that we've been in the past couple of weeks. The agenda item was added by actually the request from Commissioner Strand and wanting to talk about some of the things that are in the news right now and where we are heading. And right now we're at a little bit of a standstill, but so the first one up for the discussion that the state has been bringing to our attention is the global measles right now. So we're going to go from broad to narrow. But the global measles in Mexico, there's an outbreak that's been declared and was over now. And then Canada had 5,000 cases from 10 different jurisdictions as of September 14th in 2025. Israel outbreak as ultra-Orthodox Jewish community, and London is reporting cases in the same community. When we look at the United States, we have just over 1,500 cases currently, with 12% of those hospitalized. The current concentration of measles is happening within Arizona and Utah. And then in North Dakota, we haven't had a measles case since July, and we continue to watch for that. So doing well there. And then when we look at our influenza, RSV, and COVID-19 for the state of North Dakota, there's 91 currently with COVID, and then 2 with the influenza and 1 with RSV. And when we go to think about Cass County, we don't have anybody currently within Cass County that has influenza or RSV, and our current case count for COVID is 31. To think about the hospitalizations that are currently happening in North Dakota, we have 20 people hospitalized with COVID and nobody hospitalized with influenza or RSV. This is from the national data, and this is coming from Jennifer Galbraith, who did a in-service for us as public health administrators in the hospital emergency preparedness group. And at the national level, COVID numbers, the highest level of people who are getting hospitalized are the 75-year-olds and plus. The next group that is the most frequently hospitalized are the less than 6 months of age, and then 64 to 74, and then 6 months to 11 months of age. And the discussion on that is that there isn't an immunization for those that are under 6 months of age, and the goal and the hope would be to vaccinate women who are pregnant so that they wouldn't pass that on to, or they would have some immunization then when they were born. This is just the current schedule as suggested for vaccinations and age groups and the people who are eligible for that. And then influenza from our last season. In the Southern Hemisphere, the vaccine offered 50% protection against the influenza-like illnesses, with 50.4% outpatient visits and just about 50% with hospitalization. In the last flu season in the United States, there were 280 pediatric deaths reported, and 89% of those were unvaccinated. And also in the last flu season, there were 109 pediatric influenza-associated encephalopathies cases, with 55% of the children previously healthy, and only 16% had received vaccination. We've had an avian bird flu. This was brought to our attention also. In North Dakota, we had 2 within Dickey County. One is a backyard chicken flock, and then there was another that is a commercial turkey flock. Those were identified in September 8th of 2025. They are current and active, and we will continue to watch those at the state level. When we look to West Nile, actually, just this, I did this slide yesterday, and as of this morning, we have 81 cases. So it is still active this season for West Nile virus, with 81 cases throughout the state of North Dakota. In Cass County, we have 16. So continue to, as it gets cooler, it might be a little bit easier to wear longer sleeves, and not today, it's 87 later, but as it gets cooler, we'll be covering up a little bit more, and hopefully not as many bites will happen. I don't want to say the freeze word will come. And this slide actually represents, this is for syphilis in North Dakota, and we've had 300 cases of that reported, and I didn't have the heat map active on that, and actually the comments on the bottom are in error. So there's a shortage of bacitracin, and they can be using doxycycline because of that shortage for the bacitracin LA that is expected to continue through June of 2026. There is also a multi-state listeria outbreak tied to packaged meats and packaged pasta meals. So we are looking, there's continued monitoring of that throughout the state as well. The board that does the vaccination recommendations to the CDC, the ACIP, met on September 18th and 19th, and they made some votes for all pregnant women to be tested for hepatitis B infection. They voted for the pediatric vaccine schedule should be updated to reflect the following changes. That a mother who tests negative would receive the first dose of hepatitis vaccine B being given at least 1 month of age. Right now it's being given at birth. And then infants may receive a dose of Hep B vaccine before 1 month according to the individual-based decision-making, which is new language in this particular ACIP meetings. The COVID-19 vaccines, there was the pediatric and adult immunization scheduled for the administration, FDA-approved COVID vaccine would be updated to this. That adults 65 and older, that the vaccination is based on individual decision-making, and that individuals 6 months to 64 years of age, vaccination based on individual-based decision-making with an emphasis on those at risk or risk-benefit of vaccine is most favorable for individuals who are at the increased risk for severe COVID disease and lowest for individuals who are not at the increased risk.
Dr. Zeverson, were you looking to ask a question? Or?
I just had a question. I mean, I'm assuming you are going over a few vaccine-related issues, so I was going to kind of wait till the end. But
I'm sorry, can you say that again?
I'm assuming you have a few more slides about vaccine things.
I think this is going to be, I think there's one more.
Okay, I can wait.
It's ultimately going to be that they made these recommendations and they haven't been signed into the CDC yet. If the CDC, acting CDC director, does not sign them in, the director for the Health and Human Services will be able to sign them in. So that we are just waiting for that right now, and there's a government shutdown, so I'm not sure if or when that's going to happen right now. Go ahead, Grant.
Is the plan for Fargo Cass Public Health to follow whatever the CDC guidelines are?
When I visited with the NACHO group, there are opportunities for people to use other guidance. So you can use, like, the public health can use the American Academy of Pediatrics, other nationally recognized groups. The NACHO group is working to write a standing order that will not include a preamble, that you would be able to go through the algorithm of whatever it is on that individual decision-making be, and that you can create your standing order from that point. We are currently giving COVID vaccinations, and we are, when the CDC does give their indication, we'll follow the CDC guidelines.
How about the hepatitis B? Is the policy going to be that we're going to tell people not to vaccinate their children until they're a month of age?
I don't know if I'm right now going to say, I can't say that right now. What I can tell you is that as a public health entity with our SHO group, we are not, I think honestly, we as a group are still trying to figure out where we're landing on that decision. What is the group that we want to lean towards as a national guidance? We have been given guidance that we cannot be one of those regional coalitions where other parts of the country are creating coalitions and looking to that coalition to create the guidance, because when that guidance is then created and recognized by them, insurance companies will pay for that, and then they're covered, if you will. But we, as a state of North Dakota in public health, are not able to do that with the current political arena, if you will. That is something that our current health officer at the state level, Sherry Adams, is working with the governor and his administration to help walk us through this, as well as with Molly Howell at the state, to just really work with the public health administrators as to what is the direction we're going to go. They are the ones who told us that we do have, like, the American Academy of Pediatrics at our disposal, but to lean to those within Century Code to use that as guidance. Sorry, I can't give a solid answer on that right now in this time.
Okay, are you done with that topic, Jen?
Only because I don't have other great answers on, on where we're
That's all right.
going with those decisions.
Anybody else?
I would say that the local health systems are not going to use the CDC guidance on the hepatitis B vaccine at 1 month of age. I mean, we're going to be using whatever, professional organizations that we recognize are, evidence-based, so.
I appreciate that.
My sense is that public health issues are going to become more and more front burner, and we need to be available to convene if there's issues that are challenging us locally that need to be addressed. We don't meet all the monthly, but this stuff is just unfolding so quickly. So my recommendation to staff and to the board is let's just be available in the wings. If there's a topic that comes our way that we need to address and discuss going forward, because I'm expecting there might be. And that's not my field. I'm just looking at the lay of the land. And I won't be taking Tylenol in the meantime. Oh, sorry, bad joke.
Oof.
All right. Anything else on that topic, Valentina? Anything? Oh, I'm sorry.
I just wanted to
Jamie?
ask one question. If the holdup on the guidelines, has that impacted the availability of COVID-19 vaccine for Fargo Cass Public Health?
I'll say this, but I'll also ask Suzanne for clarification. I think we aren't able to give it to maybe some of like the VFC programs that are more directed that way. I think we can give it to private, not VFC, if I'm correct on that. I looked the wrong way.
That was correct until we just got an email yesterday that does say that we can use VFC and then just work back with the state on getting the vaccine once that comes through federal guidance. But yes, we have been able to get COVID vaccine and we are giving it. We don't have a supply issue at this point.
Thank you.
I'm glad we're talking about this because people aren't talking about it enough. What I'm hearing from people out there is that we're not talking about COVID. And I just was at a funeral a couple weeks ago of somebody who died of COVID. And this is what people are experiencing, and then they're not testing, they're not following the numbers, they're not knowing what the trends are. We're just kind of like in the dark. Well, it's a challenging issue, and it is a local issue, and we have people whose health is dependent on us and the deliverers of healthcare locally. So.
Well, and the numbers are just what the numbers are. They're not necessarily accurate because if people aren't going in and they have COVID or they test at home, that doesn't make it to their data. So.
I would also say there's recent literature that shows that repeat COVID infections can double the likelihood of developing long COVID in pediatric patients. So I don't think it's as benign as people think.
Anybody else? All right, thank you, Jen. We'll go on to budget next. Would that be Melissa?
It will be. So let's see, what's going up on your screen? Both of them. Oh, let's see, this is expenditures. Okay, I'm going to start with the 2026 budget was approved Monday night at City Commission. Just one takeaway from that right now is the salary increases across the board were 3% to all city employees. So we'll be looking at that. And then we have not yet seen the final approved numbers for the health department. So they should be coming soon, but I can't comment on them to make sure what was approved and what wasn't approved because we haven't actually seen them in totality. As far as the budget goes through this year, August, and I looked at September numbers, even though they haven't closed September yet. In the expenditures that you're seeing there, we are at 62% as of August and at 69% as of September, which is pretty much right on budget for the year. So those numbers look good. We have some increases in our travel line items and our conference line items, and that's due to our workforce grant dollars that we got. I think we're going to have to do a budget adjustment to adjust both the revenue side and the expense side of our budget, but that should not be an issue. Other than that, there's nothing really crazy in our expenditure budgets. So you can go to the revenue slide. And the comment I just want to make here is that previously we were worried about our funding and some of our grants. We hadn't received Women's Way, family planning, immunizations, Ryan White and the WIC funding. That has all been restored to our previous funding levels. And the one caveat right now is we're waiting for the WIC contract to come through with the shutdown. That's on hold at the moment, but we should be able to be backdated retro to October 1. So shouldn't be any issues with that. I don't foresee any issues with that. It just might take a little while for that to come, which means a delay in when we are submitting the expenses to get reimbursed. So we also received additional funding for the withdrawal management unit to fund through the end of this year, which was supposed to end the end of September, but we got an additional $51,000. So that's another adjustment that'll happen to our budget. But other than that, revenue and expenses are right on course for this year, so we're looking good. Any questions on any of that?
Melissa, would you remind us, were there any gains or losses in staff? I know a year ago there were some cutbacks, and this year, is it a stable situation?
There was some changes, but it was things that were kind of cleaned up. They actually should have been taken last year and didn't come through the budget process for some reason, so those were cleaned up and removed, but we thought they were gone last year, so.
Anybody else? Jim, do you have something? All right. Valentina, anything at all?
No, I do not.
Thank you. I'm really glad you're hanging in there. Appreciate that. All right, we'll go on to the item number 12, board member terms and update from Jen Fall.
Coming up in December, there are 3 members of the board that will be expiring with their term, and we'd like to just know, moving, you don't have to answer right now, but between now and December, if you would like to renew your term, we have Dr. Nagpal and Dr. Severson and Jamie Stagg, who will be expiring in December. We'd certainly invite you to stay as board members. And then the rest of the terms are listed for awareness coming up.
So Jen, how do people in the community apply to be considered for an opening on the board? And how do current board members whose terms are up confirm that they're open to be reappointed if it should be the case?
Yep, if the current board members would wish to continue on as the board, they can let me know.
Yep.
And if anybody is interested in becoming a board member, you can go to the City of Fargo website and find our section and apply to be a board member there.
Okay. Any questions or follow-up? Anybody? All right. Next topic, proposed Board of Health schedule.
Following what we had decided in December of 2024, do these quarterly kinds of meetings work when we talk about the quarter before or the activities of the quarter before and that coming? So we would follow still with January, April, July, and October. Does that work for the board to continue?
Maybe if we could just send us all an email, get it on our calendars, and we could follow up if we have conflicts. And we
Very
might
good.
have three openings to fit into that schedule discussion as well.
Very good.
Hopefully the same people. Okay?
Can
Anything
do.
else on health schedule, Board of Health schedule? Jen, could I take the liberty, please? I'm sorry, but I'd like us to run around the table and introduce all of your staff here so that we have faces, names to the faces, and see who's in your departments of yours, because it's really important. These are the people carrying the loads on a daily basis, and they're feet on the ground, if you don't mind.
I don't mind. I don't know if they mind, but go ahead. Do you want to start on your side, Doreen?
Hello, I am Doreen Odera, and I also work with Abby, and we do tobacco prevention. I've been with Fargo Coast Public Health for the last 1.5 years. Thank you.
Abby Lang, I do mental health as well as tobacco is what I do with FargoCast.
Grant Larson, Director of Environmental Health.
Jan Eliason, Director of Harm Reduction Programs.
Jesse Lindeman, Health Officer.
Holly Scott, Public Information Officer.
Suzanne Schaefer, Director of Nursing.
Lori Sal, Principal Office Associate.
Lynn Welk, Office Associate.
Melissa Parola, Account.
And you've had to hear me all day, so Jen Fall.
There are not words, adequate words to thank our people appropriately for what they do on a daily basis, you know, and what they deliver. Mayor Dardis,
I'd like to know who these folks are.
and Mayor Dardis would like to know who this group is over there. NDSU Senior Nursing Students in Public Health. That's why you recognize them, Meg. All right. So thank you, people. Keep everybody well. Make sure that everybody knows they're appreciated and that their work is valued and that we are doing, you know, that we're on a path that's for the greater good of the people. We're all part of that, and it's not always easy. It's not going to get any easier some ways, but that's why we signed up for this. Anything else for the good of the order? Anybody else? Valentina, anything? If not, we'll stand adjourned, and thanks everyone for being here today.